Senator Hassan.
Thank you, Mr. Chairman, and thanks to you and Ranking Member Cassidy for this hearing. Dr. Bertagnolli, it is so good to see you, and congratulations on your nomination. Thank you for your willingness to serve. I want to follow up on a line that you heard from Senator Murray and just now from Senator Smith. The National Institute on Drug Abuse at the NIH plays a vital role in responding to emerging trends in substance use and addiction. This institute has contributed substantially to our understanding of medication-assisted treatments for opioid use disorder and helped validate the effectiveness and safety of evidence-based medications to treat addiction, such as buprenorphine. As a result of NIH's leadership, buprenorphine is now widely accepted as a gold standard of care for individuals struggling with opioid use. Last year, I worked with Senator Murkowski to pass into law the Mainstreaming Addiction Treatment Act, which eliminated an unnecessary hurdle for providers who are prescribing buprenorphine and further expanded access to this life-saving treatment. However, despite this push to increase access, research shows that high levels of stigma and lack of provider education still stand in the way of individuals receiving medication-assisted treatment. Doctor, can you tell us how you will develop strategies to eliminate the stigma around medication-assisted treatment?
Oh, thank you for that question. And yes, I think that the overall issue of substance abuse is, first of all, it's a tragedy, and second of all, that tragedy is compounded when on top of it there's also stigma associated with the disease. So that stigma needs to be combated at every step. I always fall back to what is the first and most important relationship. That's the treating physician and the patient together. I think trust between those two individuals is absolutely key, trust and support. But then I also think we can do more to raise community awareness, in every regard. And this is yet another area of what's the best way, the most respectful way, the most appropriate way to garner community support for our individuals battling such substance abuse. This is another really important area of research to make sure that we know how to do it respectfully and well.
Well, thank you. Will you commit to continuing to grow the National Institute on Drug Abuse's work on treatment for substance use disorders?
I will commit to working with you to fully pursue work at NIH to end the scourge of substance abuse.
Thank you. I want to move to a different topic. Antibiotic resistance is a serious emerging threat to global public health. In July, you and I discussed the NIH's important role in antimicrobial resistance research and development. We need to work together to encourage the development of new medications that are able to treat infections that are unresponsive to current antibiotics. Doctor, how do you envision NIH's role in the public-private partnership to combat antimicrobial resistance?
Certainly, this is a critical issue for drug development and which has been successful in a long time to a certain degree in being able to head off the continual problem of antimicrobial resistance. And I fully support any research that can help us get to that aim for people. I'll also add that, like virtually everything we do in medicine, there is also a social and an educational component to this, right? So it's not just finding a new drug to beat the bug. It's making sure that prescribing practices for antibiotics or use in agriculture, all of these other efforts that really can make the problem worse and perpetuate the problem also need to be an area of our research to be able to combat.
Well, I thank you for that. Are there other new strategies that you could be looking at to improve clinical trials for new antimicrobial medications? Because I understand the last point you made, but I think we also need to make sure that we're continuing the research so that we have new classes of these medications.
Yes, thank you. This is a very important issue for clinical trials. I will also just take it as a side to say we have so much work to do in the clinical trials arena, and one of the other commitments I want to make is for clinical trials, since it's been one of my core expertise, that are faster, more inclusive, more responsive to the needs of people. It's one of the major initiatives that I'd like to see happen at NIH.
Well, I appreciate that. I just also want to look forward to working with you. I'm interested in bipartisan approaches to support innovative antimicrobial research, including through leveraging the tax code, and I really look forward to working with you and the rest of the department to achieve this goal. Thank you, Mr. Chair.
I defer to Senator Murkowski.